produced than what there are with polyethylene. Also, the immunological activity to the polyethylene is much stronger than what it is. We're finding that metal is probably just as immunogenic, if not. The disadvantages there, the fracture risk is pretty low. These studies have shown it's 0.07%, so that's almost negligible. Chipping on insertion has been addressed with putting metal rims around the ceramic liners to stop it from chipping on location. Squeaking, and this is widely reported, between 0.5% and about 25%, and particularly troublesome have been the Trident accolade combinations, and other one that's been implicated there is an accolade with head-on a B40 stem, so one of the striker ones. The squeak is produced by vibration, which we talk about a driving force, which is the bearing producing a resonation, and then another part of the implant or host tissues and resonating it, producing a dynamic response. We get strike wear from edge loading again, and the other problem is if we fracture a ceramic on ceramic, we need to revive the ceramic on ceramic articulation as well. This is just an example of some strike wear. It's caused by micro separation. So one of the properties of the ceramic is that it forms good fluid film for lubrication that reduces abrasive wear and also reduces micro separation. But in edge loading, it's increased pressures and less surface area, so it doesn't lubricate as well. And you get this wearing on the edge of the liner on the head. And it also causes squeaking. Impingement's also been implicated in this. Quick note on wear in total knee arthroplasty. Most of the data is on metal and polyethylene. There are some oxinium femoral components as well. We don't have as much information on that. Different forces imparted than what there are in total hip arthroplasty, including point loading. There's less conformity of the articulations, more shear stress, and the posts in the posterior stabilised undergo more bending stresses as well. And wear in other polyethylene is a late cause of failure in total knee arthroplasty. Patient factors similar to total hip replacement. Surgical factors, the flexion of the femoral component, which should read, has been implicated. Hyperextension of the knee, particularly impingement on the PS post, and malalignment, increasing contact stresses. And the implant factors, the constraint, mobile bearing is shown to have less wear than what crucial retaining than PS. The liner material that using cross-link versus ultra-high molecular weight, and the backside work been addressed by better locking mechanisms and smooth tibial base plate surfaces. The modes of failure, normally the worry is about fatigue and delamination because of the decreased toughness of the cross-link polyethylene after radiation. That hasn't really been shown to be a problem in vitro so far. Adhesive and abrasive wear, and again, particulate debris producing osteolysis. There's sort of alluded to before, some of the companies are adding vitamin E to the polyethylene to reduce or to have an antioxidant effect and reduce the free radicals in there, so thereby maintaining strength in the in vitro wear characteristics, again, as said, that the cross-link polyethylene is probably not as suitable for knee arthroplasty, but the in vivo studies don't suggest this. There's only a few case studies, and largest series of 2 patients with fractures of the posterior stabilized post. So I'll just have a quick look at bearing surfaces on the joint registry. They're probably more to us. The real outlier here is the metal on metal group. The ceramicized metal and polyethylene does have the lowest rate of revision per 100 phone years, but we've only got 6-year follow-up on that at the moment. Metal and polyethylene is still a very reliable option, and ceramic and polyethylene, well, we don't have revision as well. Looking at the metal on metal articulations, it's not all bad news. The original 28mm heads actually had a low revision rate, and it's really since they started increasing the head size to 32 and beyond that you get this increase in the rate of revision. And that with the 28mm head size, that's quite similar to what we've seen with ceramic on poly or metal on cross-link polyethylene also. So as we increase head size, we know that producing more of these metal ions. The revision rates, when it's broken down for less than or equal to or above 32mm, you can see there's a sharp increase in the revision rate and above 32mm heads. The male-female discrepancy is the big one here. You can see the male-female gender divide no different for the less than 32 millimetre heads, but greater than 32 millimetre heads is a much higher revision rate than female, so it should be avoided in this group. Cumulative revision, you can see metal on metal versus metal on poly, and really the loosening is significantly higher in the metal group. The early groups, the dislocation is more of an issue with poly, but you can assume that's because they're using it lower. When you look at the head sizes alone there, 32 millimetre or below, fairly similar result, but as soon as you increase your head size to above 32 in the metal group, incidence of loosening. Just a small note in ceramic on ceramic, its cumulative revision is quite low, lower than polyethylene at the 9-year follow-up. And the ceramicized metal here, we can see it only a 6-year follow-up, which is promising as well. Very characteristic. There isn't one for them. There's really only animal studies on the effects of this different ion, no human studies, so we don't know. Local tissue reaction as well. So. Having their levels measured doesn't mean that. Normally only increase for the first 3 years or so, I think, and then with the ASR. That was within resurfacing populations, whereas in arthroplasty populations, the 28 years. It's not those figures on for this research. No, it's really resurfacing out as well, complicating. But the 28 millimetre heads, I think, initially came out. Thirty-two and 28 have been okay. Yes, I mean, this idea of predicting failure is of interest to me. Polyethylene. Hardly off that scanner and I can measure. Very hard to measure on metal. Less than 5 micro swim. Any other questions? Thank you, Aaron.